and move the country forward. That's what we do every quarter. And I tell you the truth, you can never exhaust this review just in one meeting. Because what happened in Q1 that helped you to achieve results or made you not to achieve is most likely going to change by the time you get to Q2. Now, we're working under what we call the Nigeria Health Sector Renewal Investment Initiative that started, like the commissioner said, in 2023 December, when all stakeholders, state governors, and leadership at the federal level came together to sign the compact. That was in 2023 December 12th to be precise. If you count the years or months, this should be like 2.5 years down the line. So it's high time we actually start asking ourselves, so are we going in the right direction? The targets we set to achieve when we started, are we going in a direction that suggests to us that we're likely to achieve that target or even surpass it? That is what we're doing. And last year, during the joint annual review meeting in Abuja, I remember there was an addendum to that compact that was signed. And just as we have in this room, we have multi-stakeholders that came out to sign. Even, I think it was the Emir of Shonga, that came to represent the traditional rulers. So it's good to see everyone in this room, from the leadership of the State Health Ministry, even to the representative of the people, that's the traditional rulers. They should know what is happening. When we say we are doing swap, what exactly do we mean? And are we doing it? The stakeholders include the citizen. And I'm also happy that the CSOs are also here, so that they will know exactly what we plan to do in Q1, and we put what we plan versus what we achieve. And then we agree on what we plan to also achieve in Q2, so that when we come back again, sometimes in Q3, we will also be able to put what was planned beside whatever it is that we achieved. So meetings like this help us to keep the focus, to weather the storms, the challenges, and to keep pushing towards our common goal. So what's the goal? What do we really want to achieve in the health sector? At the end of the day, we have very simplified goal of the reform, which is we want to save more lives. We want to reduce physical and financial pain. We don't want people not to be able to access care just because they don't have money. So if you take somebody to the hospital, the first thing should not be go and deposit. The first thing should be that we take away whatever brought you, we attend to you, stabilize you, then we can come and talk about money later if need be. But preferably we want people to be covered by health insurance, so that they don't have, to suffer because they don't have money to pay immediately. And lastly, we want to produce health for all Nigerians, and we are doing this through what we call the sector-wide approach. I'm happy that Plateau State is one of the states that is actually working using the SWOP principles. And I've had people mention them here and there during the goodwill. We have one plan. Yes, I've had somebody refer to having one plan. That's when we do our AOP. We plan as a sector. We are not planning as the State Primary Healthcare Development Agency, and then the Ministry of Health has a separate plan. All agencies, departments, everybody, it is one health sector. If malaria kills one person, it will not be reported as SPHCDA. It will not be reported as health insurance or health management, but it will be reported that in Plateau State, malaria killed one person, and that affects the entire health sector. So I've had one plan, I've had one budget, which means when we make our plans, then we present to the government, to the governor, to say this is our plan for this year, this is what it will cost to move us from where we are to where we want to be. And then we have one budget for that plan. Then there's the one report, which is part of one, in fact, the one report, one voice, one conversation Everything is happening together in this room now because we want to have one conversation. We don't want to meet the MDA separately and then later we come and meet the traditional rulers later. We want to have one conversation in which all of us as stakeholders in the health sector, we sit together to assess our plans, to make decisions jointly, and to also, put heads together or around what needs to be done to solve our challenges. I know that we've also tasked the states to prepare to do their joint annual review by, I think, the end of June or July. So we're looking forward to having that as well. And I'm hoping that that will be an even bigger meeting than this. So thank you very much for having me. It's a pleasure to be here. I think my first time in Jos was in 1999. I was going to Port School for NYSC, so we had to come through Jos. But I've been to Jos several times after that. So it's good to always come around. Thank you very much. Let's have a fruitful day.
Of course, from the Office of the National Sector-Wide Approach, may we applaud her more, please. Thank you very much for opening up and widening our understanding on more on what we'll be doing here today. The Honorable Commissioner, ladies and gentlemen, I think we will be having the first presentation of the day. And to do justice to the first presentation, I want to invite the Director, Primary Healthcare, to come up. Please put your hands together for the Director, please. Today we will be having a series of presentations, reports, and we should be getting ready for questions and answers and some analysis sections, please. Ma'am.
Okay. Good morning, everyone. I am by name Comrade Mike. At the grassroots. expedite payment of the outstanding September 2020 salary arrears. Penalties to be imposed on OIC's absence from meetings to encourage full participation. OICs should ensure all work is properly documented, and all data tools are available during validation to enhance facility performance level. OICs to strengthen efforts to improve the RAMCA score and aim for advancement to stage 2. Was a local government. Some facilities do not have their AOP available. At the LGA level, most activities in the AOP were not carried out due to financial constraints and other bottlenecks. Late initiation of ANC in the scorecard despite health shock. Poor updates in IPT due to stock out in some facilities. Low SBA deliveries in the scorecard. Inadequate data tools, e.g. MSF and OPD register. Low client flow in some facilities. Poor SMS submission in some facilities. The low supervision coverage. Their recommendations. All facilities should have their AOP available. The DPHC to intensify advocacy for support to carry out pending AOP activities. More awareness on early ANC and hospital delivery should be intensified. Facilities should make IPT available because of its importance. OIC to mentor staff on correct entries of SBA into the data tools. All OIC to improvise and create all columns of data elements using a long notebook before new data tools are produced. Staff attitude causing low client flow and unnecessary charges should be looked into. Justice. Attitude of health workers towards client and patient. Underreporting of deliveries by SBA, PNC not reported ANC first visit. No tracking and follow-up of IPT uptake by health workers. MPC DDSR and grievance redress committee meet active in some wards. Recommendation. Health workers on duty must be friendly to their clients. Patients must be in their correct uniform. Active involvement of WDCs/DVCs by the OIC to plan activities at health facility and at community level. All deliveries in the community and health facilities should be reported appropriately. PNC and ANC first visit should be reported appropriately. All PMTC services should be integrated in the health facility to discourage stigmatization. Advocacy, communication, and social mobilization on all services should be intensified by the OIC and town announcers. Lantern notes, challenges. Inadequate manpower, poor turnout during outreach activities, shortage of essential drugs and commodities, transportation challenges during supervision and outreach, delayed submission of reports from some facilities. Recommendation. OICs should intensify community sensitization activities. Monthly performance review meetings should continue regularly. Supportive supervision across facilities should be strengthened. Underperforming facilities should develop immediate improvement plans. Staff punctuality, commitment, and teamwork should be improved. Kanke local government. Incorrect data documentation, knowledge gap on the part of the health workers, lack of commitment, and also the issue of HRH, attitude of staff towards the patient or clients. Recommendation. Documentation should be done correctly. Staff should be friendly and show empathy to patients or clients. There should be commitment on the part of the health workers. OIC should embark the habit of cascading training to subordinates. Basa local government challenges. Issue of staff accommodation in 11 health facilities. Issues of potable water supply. Issue of electricity supply. Infrastructural issues including fencing. BSCPF ad hoc staff salaries are not up to date. Challenges of Jos South. Shortage of manpower, misconduct by some voluntary staff. Concern were raised regarding some voluntary staff who allegedly overcharge patients for personal gain. This practice has discouraged some patients from visiting the facilities. Hiding services such as ANC and delivery payments. Conducting deliveries secretly and keeping the money. Administering incorrect drugs to clients. Clinic issues and suggested solution. Identify problems, lack of privacy. Some clients prefer not to deliver their babies at the clinic due to the insufficient privacy. Inadequate space. There are no dedicated halls for ANC care, delivering services, immunization services. Continue Jos South. Lack of observation room. Patient cannot be adequately monitored after treatment because there is no observation room. High cost of drugs. Many drugs are too expensive, and some patients are experiencing drug resistance. Lack of security and mobility. The clinic lacks adequate security and transportation support. Recommendation. Students on practical attachment should always be supervised and should handle patient alone. Shouldn't handle patient alone. Laboratory staff should be properly monitored, as some reportedly overcharge patients, leaving them unable to avoid prescribed drugs after laboratory tests. Staff should maintain proper dress code by wearing uniform while on duty. Health workers should build good relationship with patients and treat them kindly and respectfully. Just not challenges. Poor documentation and incomplete reporting of some facilities. Inadequate supportive supervision and feedback mechanism. Poor client-provider relationship in some health facilities. Staff absenteeism, and weak commitment to assign responsibilities. Low community mobilization and sensitization efforts. Delay step-down communication from OICs to subordinate staff. Preference of some clients for facilities outside their catchment area. Recommendation. All facilities should strengthen data quality assurance and ensure timely reporting. OICs should conduct regular step-down meetings with facilities staff. Health workers should demonstrate professionalism, empathy, and respectful maternity care. Community engagement activities should be intensified. Supportive supervision visits should be conducted regularly. Staff absenteeism should be addressed through accountability measures. Continuous mentorship should be provided. Kanke local government. The issue of facility operating without proper reporting. Private health facilities were not submitting their reports for entry into the DHIS2, which contributed to missing reports. Recommendation. The LGA team resolved to engage private facilities to ensure the timely submission of their reports for data entry. Furthermore, it was noted that appropriate actions will be taken regarding OICs who are not performing satisfactorily, particularly concerning their attitude and commitment to work responsibilities. Mangu local government challenges. The LGA MIE officer challenged the OIC for ineffective utilization of laptops given to them for data entry, low administration of HPV vaccine. Recommendation. Search of eligible girls for HPV in the community, most especially schools. The MIE officer also asked OIC to track their business plan, AOP, and ensure that the plans are implemented to the latter. Function local government. Incorrect data documentation by SBA. Knowledge gap on the part of the SBAs. Lack of commitment by SBA. Inadequate human resources for health. Attitude of staff towards the patient or client. Recommendation. Documentation should be done correctly. Staff should be friendly and should show empathy to patient or client. There should be commitment on the side of the health workers. OIC should cultivate the habit of cascading training to subordinates. Local government challenges. Poor reporting performance regarding routine immunization as seen from the ranker scorecard. Inconsistent SMS submission for both planned and conducted RI section. Manpower shortage, low facility patronage, gaps in supervision. Recommendation. All OICs must use the correct format of sending SMS. SMS reports must be sent either in the morning or immediately after a session is conducted. LGA team members are mandated to physically inspect the phone of OICs or RI focal persons during supportive supervision to confirm that SMS reports were actually sent. Supportive supervision visits should be regularized to provide continuous mentorship and practical training to staff. Staff must intensify community engagement activities to drive up patronage and improve health outcome of your local government. OICs are required to step down to ensure the BSNO emphasize the importance of maintaining high standards and doing their best to ensure no report due to the temporary closure of the facility due to no structure. Samlong PAC, low performance in early ANC in Q4 2025. Given to pregnant women, low ANC initiative lack adequate understanding of the indicators. Shandam local government. All facilities should try the